Hello, my name's Yoo Byung-wook, and I am a professor of family medicine at Suncheon University's International Healthcare Center. Today, I'm going to talk to you about infectious diseases in developing countries. Through this lecture, I hope that you will be able to work safely overseas. I will now begin my lecture. The lecture is divided into two parts. Firstly, the precautions before departure, and then about infectious diseases. Precautions before departure. Where do we look for them? Many of you may be wondering this, and in the search bar, you know the green search bar. If you search in international infectious diseases now, the information comes up. And then also add the country that you want to visit. For example, Ethiopia. When you search Ethiopia, you realize you need to get a yellow fever vaccination. Oh, hepatitis A is trending right now. Malaria isn't as common? All of this information shows up. Very basic information shows up. In fact, you can also visit safety websites and check the alert level. Then visit the Overseas Missions Consular Call Center 040.go.kr. But do you know what's the most important? You should always share your itinerary with your family or relatives. Now you need to get vaccinated. What should you get? You probably have questions. Is it okay to get 5 or 6 vaccinations in a day? Yes, you won't die if you do. And you have to get them to leave. It doesn't matter if you get 4 or 5 a day, but please consult with your doctor. So let's see what vaccinations there are. First, there are vaccinations from each country. But for yellow fever vaccination, you need to get them to go to Africa or specific countries or you can't get a visa. You won't be able to enter the country either. In the case of meningococcal, you need to get a vaccination when you go to Saudi Arabia's Mecca, the Muslim pilgrimage, or Africa's meningococcal belt. You can still enter the country even if you don't get it, but it'll be like pouring gasoline on your body and jumping into the fire. That's how dangerous it is. So you have to do the 2 things that I mentioned. The rest are hepatitis A, Salmonella typhi, and influenza, the 3 seasonal flu, which you need to get steadily. Oh, I have a question. Is there no vaccination against malaria? The answer? Yes, there is an anti-malaria vaccination. But this is a serotype that applies to Africans, so Asians like us will die within 15 to 30 minutes. You've heard of anaphylactic shock, right? If that's the case, you need to take medicine for malaria. But should you take it? First of all, malaria is a parasitic disease. And then, the most common thing that happens is traveler's diarrhea. In 2009, I went on a business trip to Cambodia and I remember having diarrhea 40 times during the 3 nights and 4 days. There's a small fish lake from Lake Tonle Sap called Prahok, which is also Cambodia's money unit reel. They smashed the fish and mixed it with the rice, and the moment I ate it, it felt a bit strange, but I continued eating it. I got really sick after eating. Indeed, there are viruses, germs, and parasites. Fortunately, if you don't have any underlying diseases, you'll be easily cured. But if you do have underlying diseases, it can be fatal, so please be careful. You need to avoid clumsy food challenges like what I did. In particular, recently we've all been good at washing our hands. So wash your hands before you eat, and eat at a trustworthy place. And there's a saying that the next disease that mosquitoes or other insects can cause, when we talk about mosquitoes, we usually say malaria, but do you know? Dengue is also quite challenging. There are a lot of people that got dengue fever. So, what's chi-chi-chi-chi? A mosquito repellent. And next, always use a mosquito net. And strangely, there are people who go around early in the morning. I don't know why they go around. Mosquitoes prefer time around sunset or when the sun rises. In this case, I think it would be best to refrain from going out. I want to tell you this about hepatitis A. In South Korea, no one between the ages of 15 to about 39 has antibodies for hepatitis A. So it's good to get a vaccination even when you're here. Hepatitis A is actually more common in developing countries. This is because in developing countries, hepatitis A virus is already exposed a lot, so many people have antibodies. But do you have antibodies? Probably not. In South Korea, kids born after 2013 receive 2 free vaccinations from the state. And you're probably not born after 2013, right? But people ages 45 and up usually have antibodies. Why is that? Most people who are older than me, I'm also going to be 50 soon, have antibodies. Okay, then Salmonella typhi. For Salmonella typhi vaccination, there is already an injection. But recently, they released an edible vaccine. Salmonella typhi is unexpectedly very dangerous as it can be transmitted through food. So people who are in their 50s. Youth begins when you're 50. Many tourists to Southeast Asia are in their 50s to 60s. And when they go, those with chronic diseases suffer a lot. In fact, the number of patients is increasing. Typhoid develops a lot amongst the 40s to 50s during overseas trips. Young people actually don't get Salmonella typhi as much. But as for vaccination, I get it every year. Those who travel overseas take it or get vaccinated every 3 to 5 years. But even if you got a Salmonella typhi vaccination, it doesn't mean it's 100% effective. It's not fatal, but you may feel slightly sick, and that's why vaccination and personal hygiene management are very important. What's the conclusion? It's best to get the vaccination. As you may know, JE is infected through mosquitoes. Most people in their 40s received vaccinations when they were little, so they have antibodies. The problem is that people in their 60s never received the JE vaccination, and they're actually more at risk. Rabies. Isn't rabies vaccination only for my dog? Rabies diseases are actually very fatal, and many people don't even know about rabies vaccination. You may think it's only for your pet, but that's not the case. So here, I have a quiz. What do you get when a cow bites you? 1, 2, 3. Yes, you're right. It's not rabies, it's mad cow disease. Instead of the rabies virus, it's better to use rabies virus infection. At the farms where they take care of livestock, people actually get rabies virus vaccination. That's because cows bite sometimes. In fact, these mammals' saliva and blood penetrate through people's soft tissues or the skin and can't drink water and die. It invades the brain and nervous system and causes convulsion seizures, which result in death. It's a terrible disease. You need to get a total of 3 vaccinations. You can get it 3 times, 4 weeks in advance. But during your trip planning, just remember that you need to get it once today, another week after, then another 3 weeks after for a total of 3 weeks. It's true that recently influenza vaccination has become more recognized because of COVID-19. But do you know? In 2009-2010, after H1N1 swine flu outbreak, vaccination quickly went up. But from 2013 to 2017, only a few young people have flu, seasonal influenza vaccination. Also, if you're overseas, you may not easily get influenza treatment. Check the seasons of the southern and northern hemispheres and get the vaccination. As for cholera, there's still cholera? But India is a large empire of cholera. In some rivers, people do their laundry, drink the water, wash their babies, and go to the washroom. Cholera doesn't come with a sound, but it's actually very close to us. The vaccination for cholera isn't a needle, but edible. Today's highlight is yellow fever. You can't get a visa if you don't have the yellow fever vaccination and yellow card certification. Also, doctors consider yellow fever as a very convenient disease. What's the reason? The fatality rate is 100%, so doctors don't have to do anything. Here, I recorded 50% as death, but actually 50% is love for a week. And the rest of 50% is death within a few months. Even if you survive, you can't perform normal activities because of a fatal merger of cardiovascular and cerebral systems. But ironically, if you get the vaccination, you're 100% safe. I have another good news. Before, professionals needed to get it every 7 years, ordinary people every 10 years. But according to WHO in 2015, if you get the vaccination once, you'll have lifelong immunity. Who started the commercialization of meningococcal vaccination? I did. I used to bring some in the past but commercialized it, so currently all military personnel training soldiers get the vaccination for free. Why? Isn't it only for Africa? No. It arises in dormitories, collective living spaces. For Africa, meningococcal occurs in areas that are dry and crowded. It also arises in places like Saudi Arabia, Mecca, and Medina. Even in South Korea, the Saudi Arabia embassy issues a visa only after you get vaccinated by the Korea Muslim Federation, the Islam Federation. It indicates the most dangerous regions along the belt. For the sub-Saharan region, it's because people no longer live there. Africa is a must for vaccination as patients were found in Zambia and South Africa. Recently, I graduated from a provincial university too. But it is also known as the vaccination that parents would give to their children before they go to dormitories at a provincial university. I hope you carefully consider everything and have a safe trip overseas. Thank you.